Hi, I'm Nancy Drum. I'm the Membership Director of the Woodbridge Metro Chamber of Commerce. I'm here today with Dr. Fontana from the MRI of Woodbridge Doctors Radiology Center, located at Peach Plaza, 1500 St. George Avenue in Avenel. How long have you been here in Avenel?
We've been here for about 30, actually exactly 30 years.
30
We
years.
opened our doors in 1986.
Wow.
And we had 4 employees to include technologists, and now we have over 40 employees. And we've grown since then. But at first we just had we had x-rays and an ultrasound, and now we're a full-service radiology center.
Full Service Radiology Center. What does that mean?
So that means that we have all kinds of different modalities of x-rays, what we started with. We have ultrasound, MRI, CAT scan, and mammography. And most recently, we've evolved with a mammography from initially we had something called zero mammography, which were actually images that were done on paper. And then we graduated from that to film screen mammography. And then after that, we went to digital mammography. And then just this last week, we had the latest in mammography. It's called 3D tomography.
Yeah,
So-
why don't you talk a little bit, Dr. Fontana, about some of the new things and keeping up with technology and some of the great things that you do here. I understand that you have an ACR radiology accreditation that came to you recently with all
Yes.
your hard work with your
Yes.
doctors here. If you want to talk a little bit about what that means.
Sure. So about a year or so ago, we received the designation from the American College of Radiology. They're the college that governs all the radiology, basically. And they have a special designation that very, very few centers have. It's called the Diagnostic Imaging Center of Excellence. And it was so rare. I think at the time last year, we were one of 22 places, radiology centers in the entire country that
Wow.
had that designation. So what that means is that each one of our departments within have to be at a certain standard. And then above and beyond that, they look at things like policies and procedures, safety, radiation dose. We have to report our radiation doses to Virginia, at Reston, Virginia, where the ACR is. And also scheduling, things of that nature. So it encompasses sort of an umbrella of all the different functions of an imaging center. And then had to meet the highest standards of safety, quality, and the service to patients.
Right here in Avenel,
In Avenel.
Woodbridge Township.
Right. So
we have,
I think of ourselves as sort of a jewel, in the center of Woodbridge, and we're here to serve the patients, the best we can.
Yeah, and I understand you have something new called a 3D breast tomography.
Right.
You want to talk about that?
Right. So what that is the latest piece of breast technology to diagnose breast cancers. And what it is it takes above and beyond the standard mammography. Now, women who've had mammograms have had that experience of getting basically 2 views of each breast. Now, what this new technology does is the experience from the patient side is much the same as it was before. And the paddle that the patient sits in, and actually I'll show you what the machine looks like a little bit later.
Great.
But what it does is that it takes some images, 1 millimeter thick images of the breast, so that not only do we see x-rays through the breast, mammograms through the breast, but what it does is it pans through all the tissue in very small slices, so that we could cut through the breast density and see very subtle findings that can be the earliest signs of cancer.
Wonderful.
And not only does it do that, this technology, and this is what this represents, what it does is that it does all of that within the safe dose for the patient. So the patient is not getting an additional burden of radiation, because the technology is such that we can do that all well within the standard of the FDA for safe mammography. So we're very excited about it. We just got this technology a week ago.
Great.
And so we're starting to do that here very shortly.
Very good. Now, someone has to be referred from their physician to come here to get the x-ray,
Yes, so
right?
generally what happens is that the physician, either primary care or gynecologist, will give a woman a script. We also send out reminders to our recurrent patients, just so that they know that they're due to come in, and so that's how it's done.
And then you have a few more new things that you have here, the CT
Yes.
64X.
Yeah, I'm glad you mentioned that.
Yeah.
But we have our CAT scanners use ionizing radiation, use X-rays to take images of the body. And patients who have had it, you basically lay on a gantry that moves through a very large, sort of a donut-shaped, but not a long tunnel, very narrow donut-shaped scanner, and it takes images of the whole body. And so ionizing, there's no such thing as safe radiation. It's all we try to use the lowest dose. And what we've done is about a year ago, we invested in getting a additional technology which lowers the dose. And right now we're at 40% of the usual and standard customary dose for these studies. So what this technology does is we're able to decrease the dose with our techniques with this new software, and it reconstructs the images such that the images are fantastic quality at a much lower dose. So actually we're still sort of slowly marching down. We want to get to the point where we don't compromise the quality of the study, but getting at the lowest dose possible. So we started at basically 20 to 30% when we first got the technology. Now we're slowly modifying our protocols so that we can. Our goal is to get around 50 or so, but right now we're down to 40% of what prior does.
Very good. And then you have one more DICOE.
Right, that's the Diagnostic Imaging
Okay.
Center of Excellence
Okay.
that I was talking about.
Okay, good.
So it was a very rare honor, and it's really a testament to the staff and Judy Luxa, who's our chief technologist and our supervisor here, because it's really an undertaking that very few centers even attempt because it's so difficult to.
So you'll call yourselves the Diagnostic Imaging Center of Excellence.
Yes.
You should add that on there too,
Yes.
Judy.
Yeah.
So you joined the Chamber of Commerce.
Yes, we did.
A couple, I
months
met
ago.
you more than a
Yeah.
year ago about,
Yes.
and you joined a couple months ago, and we're very happy to have you, and we will do our best as far as bringing awareness of your business to the community,
Oh, thank you.
inside and outside of Woodbridge Township. And I understand you were at the St. Patrick's Day Parade with us at the with your group.
Yes.
And you
Yeah,
had a good time with
we
that.
proudly marched. We showed our green at the
Yeah.
at the parade. Actually, it was my partner David Wirtschafter who was at the parade. I was working that weekend, so I couldn't be there. But
Well,
we're looking forward
yeah.
to.
And we're looking forward to building our relationship with you. Thank you very much for your time.
Thank you.
Have a great day.
Thank you very much.